Well, I started with neuropathy in my right toe, my big toe, in about 2009. See, it's all your fault. That's the And I mentioned it to my doctor. He checked right away. They checked for like diabetes, and I didn't have it. So then he said, well, let's just keep an eye on it because we're not sure what's causing it at this point. So then eventually it moved up into the ball of my foot, and it was starting in the other foot. So they sent me to a podiatrist, and the podiatrist did some like moving around and testing and poking and said, yeah, you need to go see a neurologist. So then they sent me to a neurologist. And then, so that was 2011. Well, early 2011 I started seeing neurologists. And this first neurologist, he was like, right away, let's put you on blood thinners, let's start giving you this treatment that you're going to have to take every 6 months. And I was like where you're getting, admitted into the hospital and everything. I was like, let me get a second opinion, please. I don't know what's bad with you, but let's do this. I was like, so we got a second opinion, and he had no idea either, but he wasn't interested in such a drastic treatment. And so he kind of just followed it for a little while, and eventually I started getting a bit of a hammer toe in my big toe. This was about 2015. And so they decided it's probably Charcot-Marie-Tooth disease. They weren't sure. I moved down here and started being seen by a neurologist, and they were able to do some basic genetic testing, which for Charcot-Marie-Tooth disease, but it only checks for like 20 versions, and there's like over 100, I guess. So I don't have any of those 20. So if I do have it, it's one of the more rare ones. It was hard because it was like, I used to be much more active, and so that kind of really slowed me down. At first, when it was just my toe, it wasn't a big deal. But once it started becoming more of my foot, it's like I have to watch everywhere I step, everywhere. Like if I go up a stair, I gotta look where I'm going, because otherwise I trip. I just have to pay a lot of attention to what I'm doing. And then it was so much pain. So like, if my grandkids were like running around and somebody bumped into one of my feet, I was like ready to cry because it hurt so much. It was just constant pain, and then it was just that much worse if somebody touched it or bumped it or anything really. And then when it moved into my hands, it kind of made me stop feeling textures and skin and all that stuff. It's so weird because it's like I have to pay attention to what I'm touching. Even when I'm touching myself, and I have to, usually when you touch things and you touch yourself, you think about the giving end, and I had to start thinking about the receiving end, and I have to like make myself do that. It's kind of weird. Dr. Raghu took all the tests and all the records and all the labs that I have already gotten done, and he actually looked at them and reviewed them before he even decided to touch me, which I thought was amazing, because I don't think even the neurologists have been asking for all the past records. Mostly it's like, the last couple office visits, and that's about it. I got x-rays done, and he felt around my back and my neck, and then I came back, and he said, well, I think we can help you, and I want to try it. Best is I'm able to start feeling things. It's kind of like, and my feet actually have been like hurting more, but it's like it was in the beginning, so I can feel that, because like they were getting to a point where they were so dead that they weren't even really, those portions weren't even really in pain at all anymore. And now that's starting to come back. And then all of a sudden I was like, wait a minute, when's the last time I felt texture on jeans? I can put my hand in my bag and I can like feel my keys. And to be able to feel things like my husband's skin, I could like touch him and I could actually feel him, and it's a big deal.
She's not nearly as depressed because she is real artistic, so she loved working with clay. She loves wood. She'll just feel this feeling. I have no idea what I'm feeling, but okay. But she loves it, and then yeah, as her hands are going numb, she's getting really depressed about that, and suddenly it's like, all right, just throw away all the clay, throw away all the tools. It's like no, because as she was saying, the doctors on her end they're acting like morons, really. And I knew that there was something going on, because I've seen it in so many friends, that, with the sitting position. People turn. It used to be, when a million years ago, when I had a trampoline accident and I went to a chiropractor, and he said that a lot of men were coming in because they wore their wallet on the same side of their pants for years on end. So little things like that, and people don't think about it, and then they don't get it adjusted. So when you think about all the things that you can do, misstepping, and you throw your back a little bit, but you don't really know it. You just kind of get used to it, and your body readjusts and it readjusts and it readjusts. So I knew that there was something. I didn't have the insight or the education to understand exactly where the problem was in the system. I don't like buying anything twice. As a consumer, I don't like buying anything twice. So prescriptions are like that. Prescriptions are like, okay, well, here, we're going to put you on a prescription. This is going to help you deal with your pain. And then in 4 or 5 years, you're spending 40% more to do what the drug did in the first place. But it's not curing anything. It's costing more. She has all these feelings coming back, and then it's like the lights coming back on in her eyes, and she's suddenly excited. Oh, I can feel it. Oh, I can do this. And so all these tools that she wanted to throw out at one point, she's got her eyes on them now. It's like, oh, I've got, I'm going to start working with it, and which probably means more antiques will be coming in the house, but it'll be well worth it. I'm really looking forward to it, because when you're, I feel about my wife, at least this wife, the way that I feel about a small child. When you have a baby. No offense, but babies will cry and you don't know why. It's like, well, are they hungry? Are they tired? Do they have gas? Did they break a leg? Anything? I don't know. And so when she's going through this pain and she doesn't know why, there's nothing you can really do. And it's like, and it gets very frustrating. It's like, okay, well, maybe it's this cream, or, maybe it's just your skin is dry, and so you're feeling the sensation of the wind. I'm thinking 30 years down the line where she's going to say, I hate my life, I can't feel anything, I want you to kill me. And so, I'm thinking to myself, well, how am I going to do that? So, yeah. But no, this has been good.
Well, he's very lucky to have you and vice versa to take care of each other.
This type of chiropractic procedure isn't a lot of bone snapping, which makes people so very nervous. It's adjustment and readjustment and readjustment, looking for a particular alignment based on the new technology today that wasn't there.
At least try a couple of visits, let you guys review what's going on and see what's going on, because even if it doesn't cure it, which it may or may not, it's at least going to make your structure better, which should at least give you a better quality of everything else, which might at least slow things down. You don't know, so it's at least worth trying.